Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Parimala Devi. She is a renowned obstetrician and gynecologist in Bengaluru, working in Fortis, and she is a record holder of the Guinness World Record in detecting the early cancer of the cervix. And apart from that, she is a robotic surgeon and also, colposcopy, she is an expert. But today she's going to talk to us about the causes of infertility and how minimally invasive intervention can overcome those causes. Welcome, Dr. Parimala Devi.
Namaste, madam. Good afternoon. It is a real great moment to exchange few of the information which is going on in the world. Like how in the news they put headlines, very recent, what is going on, like that. In our medical field also, as a pediatric cardiologist, you have done so many procedures about 3 to 4 decades back. You are the first one, I think, who started this pediatric cardiology and treating without any surgeries. So those technological advances are still going on. I think it is one by one every day there is a lot of revolution in this technology. In that one point, what I wanted to discuss and to bring to the notice of our listeners who are always very much happy to follow our channel is this is microwave ablation. Very recently, you had a very good discussion about IVF day. These days, IVF has become so common, means the normal pregnancy we are forgetting.
People are forgetting normal pregnancy, and which is without any expenditure, totally free. But now they want to spend lakhs of rupees and, become obese and then have twins and triplets. That has become fashion.
Ask, no, this is IVF pregnancy, madam. They're telling it so casually. Okay. So we really wonder, like doctors from about since 4 decades, we are really seeing the best part of the medicine and how it is undergoing a lot of changes for the good and sometimes for some side effects. So this microwave ablation, why I wanted to highlight is for any fertility problem, there have to be some problem with the husband or with the wife. And for a woman, it is multiple problems because her uterus may carry a lot of tumors like fibroids, or it may be some adenomyosis, some thickening of the muscle wall, or there may be black in the tube and all. Black in the tube and all, that is a different issue. But fibroid is about 35 to 40% of people can have fibroids. Because of that, they may lose their pregnancy, abortions. Again, but if at all we plan to take out these fibroids, we have to go for a open method, or by laparoscopy, we are going to make a cut over the uterus and take out these fibroids.
Yeah, you are cutting on the abdomen, you are cutting on the uterus, and then going inside.
Yes. That was some few years back. After that, laparoscopically we are doing, but laparoscopically also, when we enter over the abdomen, it may not be opening, but over the
but uterus, inside the uterus, you have to open.
Take out the fibroid, and then we have to stitch it there. Otherwise, there is bleeding. Yes. We always say uterus is a bloody organ. Lot of blood vessels in that. It's like a bundle of muscle.
Plenty of blood vessels.
Blood vessels. So to control it again, we have to come on the something called tire sutures or whatever. But in that bargain, what happens? Lot of muscle from the uterus also gets weakened because you have cut it. Any bag also, if you open, cut it and stitch, there will be some leakage.
Yes, especially during delivery, the powerful contractions, and it may yield and it may rupture also.
It may rupture. The rupture of the uterus also is one discussion. I think next we are going to go after the fibroid operations and all. So here what happens is, in case of fertility problem, the lady comes, madam, I'm having a lot of pain, lot of bleeding. Then when we do the scanning, we come to know there are a lot of small, small fibroids. It can be 10, 15, 20, like that. But if at all she is having some 4 centimeter, 5 centimeter fibroid, instead of doing the cut and take out the fibroid, we usually give an option these days, what is called as a microwave ablation. As the name says, microwave, every woman or every family is quite aware of microwave.
Microwave for heating the food. Yes.
Food that is there. So here what happens, because God has given for a woman a natural orifice to deliver the baby. Through the same orifice, we push that electrode for the thermal ablation or for electric ablation, and we go and hit the fibroid which is sitting here. Under the guidance of the ultrasonography, not a blind procedure. Under the guidance of the ultrasound, we are going to, under the anesthesia, we are going to pass the electrode and then slowly we burn this fibroid. And within some 10-15 minutes, it becomes liquefied. As a discharge, it may get expelled.
Go off.
And like that only, even there is an adenomyosis can be there. We have to, our listeners should understand, fibroids are different, adenomyosis is different. Fibroids are something independent tumors because of the muscle fibers reaction. But in adenomyosis, if you imagine you are driving a car and there is suddenly some hump, there are some humps in the this one muscle wall of the uterus. That will also allow this lady not to get pregnant. Lot of cramping it will give. Adenomyosis of late, madam, it is something very interesting or pathetic. It is increased. Maybe because of the late part of the age for the marriage or for any contraceptions, unnecessarily abuse of the medicine what they take. Adenomyosis has increased now. So because of this adenomyosis also, if they are 4 to 5 centimeter, there is a limitation for this procedure. We cannot do anything which is very big fibroid or anything. Adenomyosis can be very well treated with microwave ablation. So by doing that, we can really discharge her on the same day. You need not keep her. Once it is done, after some 4 hours of anesthesia effect is
But it is done under general anesthesia.
Yeah, yes, a short general anesthesia, we can say. And then we'll call her for a follow-up for 2 or 3 months. If the criteria are fine with her husband, everything, we tell her to go ahead with the pregnancy trying. Otherwise, like before, after the removal of the fibroid, the abdomen stitches have to be taken out and laparoscopically, even though done, uterus have to heal. Uterus will not heal so easily. Even in cesarean, when we open, it will take at least some 3 weeks. We will tell her not to indulge in anything of any heavy exercise. So like that, we can give the woman immediately the pregnancy chances once she is about 2 to 3 months after microwave ablation. And it is a very minimally invasive, in that minimally invasive, we can say. So from that, she'll be very much helped to go ahead with the pregnancy. We can say.
And what about the cost, Dr. Parimala Devi?
Is it very expensive? Yes, technology, there is a cost actually because these instruments are disposable. The electrodes which is used cannot be used again. So because of that, it usually on a higher price, but a lot of insurance help now. So it can be made use by our people whenever it is required. And the bleeding also from the surgery and pain from the surgery, everything will be less because it's very microscopically it is handled. So there will not be much of this one.
Without harming the other tissues or cutting anything, you are directly going localized and specifically only liquefy that.
Heart, madam, how I used to see your
in the heart, when there is arrhythmias and then the arrhythmic center is there, we do the mapping and find out which is the center, and that center is ablated. So in the same way.
Same technology is used here also. So I would like to tell our women and families that don't take the age into your hand. Try to get pregnancy at the right age because after some certain age, these tumors, fibroids, adenomyosis, all these things are very common. So instead of getting into that problem, it's better like planning the pregnancy at the right age and try to get baby in proper time with the family. And then these things will start once you go to the higher age, and even the male partner also, husband also can have some spermatic problems. Instead of that, IVF and not try to go for a normal pregnancy so that you can save money by living simple. Get the baby and be happy also. That's what my way of thinking.
Thank you very much, Dr. Parimala Devi, for giving an insight into the newer advance in the technology. Thank you.
Microwave ablation, yes.
Thank you. Thank you.